Well, the issue of crime can often be tied to issues of improperly handled mental health cases.
This month, the city of New Orleans wants to try and fight more crime with a new approach by creating a response team strictly for mental health calls, and there are a lot of them. Leah McNeil is here in the studio with a look at why this program is important and how it's going to work.
Yeah, absolutely. It's been in the works for a year now and has actually already worked in larger cities like Seattle. So the hopes are very high for this program. Now, call takers at the Orleans Parish Communication District work 12-hour shifts, and they're oftentimes answering up to 150 calls in that time. Calls can usually fall into 3 categories, requiring fire, EMS, or police. But now they have the Mobile Crisis Intervention Unit. It will be another resource for call takers to dispatch licensed mental health care professionals to nonviolent calls when someone is in a crisis. It all stems from a push from Council Vice President Helena Moreno that led to a partnership between the city's health department, the Orleans Parish Communication District, and the nonprofit Resources for Human Development. OPCD Executive Director Tyrell Morris says it's been a seamless transition since they soft launched the program earlier this month. In just last week, he says they've already taken 50 calls, which is about 8 calls a day. That averages out to 2,900 mental health related calls a year. Morris says when a person is in a crisis, seeing an officer in uniform can agitate them even further. So this level of care will hopefully stop that and provide the necessary help almost immediately and take that burden off of NOPD.
In this case, it's a licensed mental health professional that's providing that support. Of course, police officers and other public safety officials are trained to manage and handle individuals that are in crisis, but the quality of the care you get by a licensed clinician far exceeds anything that any other public safety entity can provide.
According to the New Orleans Health Department, the responding teams are made up of at least 1 mental health care licensed professional and 1 certified crisis intervention team member. The MCIU will run 3 units, 1 for the day shift, 1 for the evening, and then of course 1 for overnight. Once the team assesses that situation, they will then decide the proper aftercare. The program will officially launch next Thursday, and at this time is only for Orleans Parish residents.